Good evening everyone. Welcome to yet another episode of BMC Global Live AlHilal Health World Nothing But Lifestyle. I am Jasila Mujib. In this talk show, in each episode, we try to bring before you an expert doctor from AlHilal Hospital to address your various health issues. Good oral hygiene is a lifetime commitment. Today the topic we are going to discuss is root canal treatment. We are delighted to have Dr. Suhana Naz from AlHilal Hospital, Hamath Town. She is a specialist in endodontics with an experience of around 15 years. So, to throw more light to the topic, let us welcome doctor to the show. Thank you for being with us in this episode.
Yeah, thank you so much for the warm welcome, and I'm really grateful to be on this show, for giving me this privilege and to be on this platform.
It's our pleasure. Now doctor, what is root canal treatment? And when does a tooth require a root canal treatment?
Okay, root canal treatment is a simple procedure in which the pulp tissue from the tooth is removed and then we place a biocompatible material inside the tooth so that it doesn't get reinfected. Basically, it is a procedure where you can save the tooth. Now you might think, what is pulp tissue? Pulp tissue is the innermost layer of the tooth which has blood vessels and nerves, and this is when it gets infected, the tooth has pain. So basically, root canal procedure, you're removing this tissue and you're cleaning it and replacing with a biocompatible material.
So doctor, how do we know that the tooth is infected? How can we know?
Okay, actually that's what the patient will come with pain. So this pain is generally continuous, persistent, and the patient will say that the pain is during hot and cold consumption. Even if after the stimuli is removed, still he will feel the sensation. And during night times, the pain is severe. That is because of the posture of the patient. On lying down, because of the pressure, he will feel that continuous pain. And secondly, sometimes the patient might not have pain, but there might be a gum boil, abscess drainage. Even then it requires a root canal because the tooth is infected, the necrosis, the pulp is dead inside. So that's when the infection happens. In some cases, we need to do a root canal, like there has been due to sensitivity. Patient, even after doing a cavity or fluoride treatment and everything, but still the patient complains of pain. In these cases, we need to do an intentional root canal. And there are cases like when there is trauma to the tooth, that's when again a root canal is required. And some of the cases like iteration, abrasion, erosion of the teeth, like dentin sensitivity is too much, the patient feels very inconvenient. So in these cases also a root canal is required. Now just to make a add on it, I'd say iteration generally happens because of this night grinding habit and everything. So generally we advise the patient to break the habit, because even after we do a root canal and give crowns, if the habit persists, it's no point going through the whole procedure. So you have these mouth guards and night guards which you can wear it in the night, and so that your habit breaks down. And abrasions generally happen because of the brushing technique. Patient generally uses horizontal strokes and keeps brushing for hours together. Rather than that, use circular strokes and brush it evenly, so up and down strokes.
Don't be hard on the
And erosions generally happen because patients with the gastric problems and everything, and that's when it happens.
Okay. So doctor, can you please explain about the pain management options during root canal treatment?
Yeah, sometimes the patient has pain during root canal treatment, but during the procedure anyways we will be giving a local anesthesia which is like Novocaine with adrenaline. And this adrenaline, generally if the patient is hypertensive, we generally give plain like Novocaine also. Anyways, coming to the pain, sometimes patient might feel a discomfort after root canal procedure, but now you get over the counter painkillers like analgesic, that is ibuprofen or diclofenac. You can use one of them, with the dentist recommendation only then, and then you should feel at ease. And definitely don't bite, like I already mentioned, don't bite or put pressure on that side unless a crown has been given. Anyways, the dentist generally reduces from the occlusion so that the forces are not applied on that. But to be more careful from your side, just be careful that you don't eat anything hard from that side and the tooth might undergo fracture, then saving is questionable.
tooth is infected, why can't we extract it instead of going for a root canal treatment?
Yeah, this is a very good question. Most of the patients come to me and say the same thing. Doctor, can we just extract the tooth? Why go through this whole hassle of, root canal and then crown and everything? The thing is, firstly they think that, okay, it's expensive treatment and it's a back tooth when it comes to posteriors. But I would say that removing the tooth would be more expensive, because once you remove the tooth, there will be difficulty in mastication, and the tooth if it's back tooth, the forces which you're putting on the tooth will be more. So once the teeth is not there, then you will start feeling the function, the difference in the function of your mastication. And when the space is available, the other adjacent teeth start drifting into that space. So again, your aesthetic will be affected. Then the patient starts realizing, oh, I should have saved the tooth. But then the patient wants to do a crown, implant or a bridge. And now implants are way expensive compared to a root canal procedure. As well as if you're going for a bridge, what happens is we have to cut the adjacent tooth to put a bridge, because in that case the adjacent tooth gets compromised, and it is like you're harming what is good to replace what you could have saved instead of extracting.
So doctor, is a root canal treatment painful? We are of the opinion that root canal treatment is painful.
Okay, this is another dental phobia which every patient has. Actually, the patient comes to the dental clinic saying that he's got a pain in the tooth. Now, the root canal procedures are done to relieve the pain. So once the infected pulp is removed, the patient is much at an ease to do a root canal procedure.
Doctor, how long does a root canal procedure require, and how many sittings the patient will have to
do for a root canal? Okay. Actually, root canal procedure, it does depends. It's like in the front tooth or back tooth. Like in front tooth, the accessibility for the root canals is very easy. Compared to the back tooth. Now, in front tooth, at a single canal, the patient can open the mouth conveniently. Whereas in the back tooth, the tooth morphology is different. There are more than multiple canals sometimes, and the opening of the mouth also is difficult, where the access to the dentist, it becomes difficult. So it might be a little time consuming, but yeah, it depends. And in case there is infection, you will require more sittings, because it has to be healed. There is a big lesion, then it has to undergo healing, and then we can complete it. So depending on the case and patient, the tooth, so many factors.
And how many sittings?
Yeah, that's what I said. Depending on the infection, basically. Like in like the front tooth, it will take 1 or 2 sittings, whereas in the back tooth, it might take 2 or 3 sittings, and depending on the infection, where you might have to give an intracanal medicament so that the infection comes down. So it's not a very lengthy procedure like how it used to be before, because now the technology has been advanced, not like the hand files which used to be done before. Now you have the rotary systems, and everything has moved ahead.
Okay. So any precautions to be taken after the root canal treatment? Please explain for our viewers.
Yeah, I would say that after root canal procedure, especially once you just finish with the root canal procedure, there will be anesthesia given. So generally the patient has the habit of biting on the lip and tongue, which would lead to ulceration. So it's better you don't eat or drink unless the numbness wears off, so that you don't have any ulceration or swelling on that side. Secondly, after the root canal procedure, the tooth might be slightly tender, because a lot of instrumentation is being done on the tooth, and so avoid eating from that side, and don't eat anything hard on that side unless the permanent filling has been done or a crown has been given, because the patient anyways comes to the dentist when most of the tooth has been compensated, so hardly any crown structure is there. So what happens is, we need to put a crown or something so that it can withstand the stresses of masticatory forces on the tooth. Yeah, otherwise it will lead to fracture. That's why.
Another thing I wanted to know, is it safe to do a root canal treatment during pregnancy?
Yeah, pregnancy, yeah, people get panicked, during pregnancy, can we go and get it done? But I would definitely advise our viewers to just, in case of pregnancy, please do and visit a dentist, because a lot of hormonal changes keeps happening during pregnancy, especially because during the first trimester, the patients generally have this morning sickness. So they are unable to keep their oral hygiene well, and there's hormonal changes which causes gum infection and everything. So basically you need to visit the dentist. And to add to that, I would say that, you know, if you don't get a treatment done, it might increase your infection and it might cause to more, you know, problems rather than a root canal. It might go into cellulitis and osteomyelitis. So rather, you know, precaution is better than, you know, cure.
Yeah.
So now one more question, it would be like, okay, which is the safe period during pregnancy? It's like, I would say the safest period is during your second trimester, because in the first trimester there's like fetal organs developing, so more of stress would be there. And during the third trimester, because of your weight gain and the patient, baby bump and everything, the position of lying down in your back would be uncomfortable for you. So it is always advisable during that second trimester to just, you know, get it done. And one more phobia they have because of the x-rays. They think, oh, x-ray radiation would harm our fetus and everything, but that's not so, because now the dental digital radiography is so advanced that the exposure is bare minimum, and along with that the lead prints are given for the precaution of the patient as well as the fetus. So it shouldn't be an issue.
It's almost safe.
Yeah, it is safe actually.
Okay.
You should be doing it.
Okay. So doctor, any medical conditions in which we cannot go for root canal treatment, like any contraindications?
As such, there's no major contraindication for root canal, because it's not a surgical procedure, and most of the patients are, you know, safe with local anesthetics. But in some cases, like patient has had a myocardial infarction within 6 months period, or terminal stages of cancer, some major conditions. In those cases, we would generally definitely advise the patient to consult the physician and only then, you know, undergo the treatment, because an antibiotic coverage would have to be given prior to that. So otherwise, only if the tooth is not, you know, been able to restore, only then it is a contraindicated. Like if there is a resorption of the tooth or there's a vertical fracture of the tooth, then definitely, I mean, you need to remove it rather than preserve it. So the dentist will advise you the best.
Okay. Doctor, what is prognosis of a root canal treated tooth?
Prognosis, again, yeah, it is actually, it can come a lifetime also, but yeah, some of the cases it doesn't, maybe because of the treatment, the way it has been treated, or it could be because of the gum infection. With period of time, there will be changes during aging. So the gum infections also can affect on the tooth and may cause, and in case most of the patients have seen when they come to the dental clinic, they would have done a root canal, but they wouldn't have gone for a crown. So it could cause the load on it and might lead to fracture of the tooth, or they would have lost the filling and cause a reinfection. So in those cases, I mean, it's not the root canal failure, it's basically ignorance of the part of the patients that, you know, has caused the problem.
Okay. If such a thing happens, we will go for a root canal again, is it so?
There is an option, I mean, with the specialist, yeah, there is an option of re-root canals nowadays, unless it is where the furcation involvement is there or there is a fracture. In such cases, it's advisable to remove it rather than, you know, repeat it. But in cases where sometimes it has not been cleaned properly or something, then yeah, definitely a root canal is always an option.
Okay. So doctor, any advice from your side for our viewers on good oral hygiene?
Yeah, definitely one thing is, please brush twice daily, and it's not basically you have to spend a lot of time brushing, it's the way you brush your teeth. Use circular or up and down strokes, and then yeah, do mouth rinsing after every meal, and I would say do flossing. And one more thing I'd like to add on is, after aerated drinks or acidic drinks, don't immediately brush your teeth. I mean, patients generally feel that, okay, now I've had this Pepsi, Cola, I will just go and brush my teeth. But actually in these cases, the dentin gets softened, the enamel layer. So it's always better you just gargle your mouth rather than, you know, because it might just wear off your dentin layer and the teeth might be more sensitive. So I think, and please visit the dentist every 6 months. Don't ignore it, because it might be just a small cavity. You might just think, okay, no pain, why should I even do it? But instead of that, just do that instead of you going for a root canal or extracting or implants, which, you know, cause more of a problem, rather economically and physically, mentally, everywhere.
Okay. Thank you, doctor. Thank you for being with us in your busy schedule.
Yeah.
and giving us a lot of valuable information about root canal treatment and also about oral hygiene.
Yeah, thank you so
once
much.
again.
My pleasure. Thanks a lot.
So viewers, I hope this was an informative episode. As doctor said, take care of your teeth. Be happy, smile always, and this is Jasila Mujib signing off. Good night.